As the world celebrates Hand Hygiene Day, Dr. Jaf Momoh, Chief Medical Director of National Hospital Abuja, calls for an improved supply of pipe-borne water to encourage hand washing culture in Nigeria. Momo made the call during a short awareness walk organized by the Infection Prevention and Control Team under the Microbiology Department of the hospital to commemorate the Hand Hygiene Day along with the rest of the world. The slogan for the 2021 World Hygiene Day is Seconds Save Lives, Clean Your Hands.
Where there's no water, people can use hand sanitizers. However, we want to encourage that provision of water all over the place is made. I know government alone cannot do this, so we want to implore the non-governmental organizations and well-meaning Nigerians to support in the provision of water for hand washing, for hand hygiene. Without water, this whole exercise will be in futility. So please, we encourage that water be provided in the nooks and crannies of the country so that the exercise will be worth the while.
Dr. Kenneth Iregbu, Chief Consultant, Clinical Microbiologist, and Chairman of the organizing team, said that the essence of the campaign was to emphasize the importance of clean hands, which could reduce infections in communities and hospitals.
So hand transmission of infection appears to be the most common route or transferring infection. So simply keeping our hands clean by washing it with water and soap or with alcohol-based hand rub will prevent a lot of transmittable infections. And so today is meant to remind us all of the importance of hand hygiene. I mean, if you recall the problem of Ebola and the COVID, what they have to do with the hand. So we need to understand the importance of hand hygiene.
Dr. Philip Nwajobi, also a clinical microbiologist and a member of the team, said dangerous organisms could be transmitted from one person to another, but could be easily controlled through hand washing with soap and water or using alcohol-based sanitizers.
Every time you come in contact with a patient, every time you come in contact with a hospital environment, even within your houses as part of your personal hygiene, we have found that hand hygiene can go a long way in terms of controlling the transmission of infections among individuals.
Dr. Onubu Amedugu, head of microbiology department, said hand hygiene was important enough to be marked every day.
It's really important to be marked every day. Marking an event helps us to always keep it on mind and therefore practice the things taught at the event continuously in our practice. So for us, hand hygiene is not something we just try to educate people on once a year. We do it on a daily basis. But a forum like this gives us a wider audience so we can tell people the very important measures for hand hygiene and how it can help spread infections even within your family and with your colleagues, with your friends, and especially in this setting with your patients. You don't want your patient to come in with malaria and the patient is going off with COVID or going off with a multi-drug resistant bacterial infection.